I just want to thank everybody for joining us today, and especially Carly and Jackie for hosting this Talking to Children with LFS webinar. It's very exciting to have Jackie on our board and being able to contribute and organize things like this to help disseminate information to our community here. So with that, I'll turn it over to Andy to introduce us and give us a little lowdown. So thanks, everybody.
All right, so welcome to this webinar on talking to your kids about Li-Fraumeni Syndrome. I'm Andy Last. I'm the Vice President of Living LFS. That was Greg Harper. He is the President of Living LFS. We are a nonprofit patient support organization with the mission to encourage, empower, and educate those living with Li-Fraumeni Syndrome by connecting them with care, resources, and others who are living LFS. Our presenters today are Living LFS Medical Advisory Chair Jackie Schienda. She's SCM CGC. She's a genetic counselor at Dana-Farber Cancer Institute. And Carly Grant, MS CGC. She's a genetic counselor at Massachusetts General Hospital. So with that, I am going to turn it over to Jackie and Carly right now. Thank you all for joining us. And Jackie and Carly, thank you for joining us as well. And please tell us more about yourselves.
Sure. Thank you. Thank you, Andy and Greg and Living LFS for inviting us to give this talk. I am a genetic counselor, as Andy said. I've been working with families who have LFS for about 14 years now. I'm currently the lead genetic counselor within the Pediatric Cancer Genetic Risk Program at Dana-Farber. And I have two kids. My kids are 5.5 and 7. And Carly and I actually met a lot of you and the board members of Living LFS a couple years ago at family camp, which was really truly a life-changing experience for me, and I know Carly as well. And we are so looking forward to meeting more of you next year at the family camp in Colorado.
Yeah, thank you for having us today. I would definitely echo Jackie's excitement about the next family camp. I was totally moved, and I don't even know how to put into words experience at the last family camp. But I'm really excited to be here. I work at Mass General. As Andy said, I used to work at Dana-Farber with Jackie, and that's how we became friends. So really exciting to be able to work together again. And do this presentation today. I guess on a more personal note, I have 4 kids, including identical twin girls and a 10-year-old son and a 14-year-old teenager, freshman in high school daughter. And yeah, I've been working with Li-Fraumeni families probably for about the same amount of time as Jackie, probably 13 or 14 years or so. So really excited to be here.
Thanks, Carly. So I'm gonna share my screen, and Carly, is it up?
I don't see it yet. Yes, now I see it. Yep.
Okay, great. So in clinic, Carly and I have gotten the questions over and over again from our families, not only those with LFS, but many other cancer predisposition conditions. How do I tell my child that this is in the family? When do I tell them? What age do I tell them? How do I tell them? And it mainly comes from the parents receiving these questions from their kids. So they're asked, Mom, why am I getting an MRI and my brother's not? Dad, why does so-and-so have all these doctor's visits, but I don't? Mom, why do you have cancer? Am I going to get cancer like you? Or Dad, I know we had the genetic testing done 2 months ago. They said the results were going to be back in a month, but it's been 2 months, and where are the results? What are the results? Do you know them? And so these were the questions that I was getting over and over again. And so a few years ago, I decided to create this talk geared towards genetic counselors and really for them to help them answer these questions for their families. And then I've been lucky enough to work with Carly, and we decided that it would be great to modify the talk that I originally gave to the counselors and really modify it and provide this same information for you. And so that's what we've done today. And so hopefully we'll give you some helpful information. And we'd like also, like Andy said, we'd like to hear from you at the end, but we're going to walk through, first, we're going to walk through what the research has told us. So what we know from the research about having these conversations with kids. And then we're going to give you some practical suggestions about language that you can use when having these discussions with your kids. And finally, give you some tips and tricks that we've learned in clinic and from our families. And then hopefully we'll hear from you about your experiences, what's worked well for you, what hasn't worked well, what advice you have for other families in your situation. What does the research tell us about disclosing or not disclosing? So sharing these results about LFS, about cancer risk, about having a gene mutation to children. So I should say that overall, the literature and the research is really supportive towards disclosure. So they found overall that there's seems to be many more benefits to having these conversations and having them early, as opposed to not having these conversations. And so I also want to let you know that a lot of this research, we have the citations at the bottom of each slide, but most of this research was done on small cohorts of patients. So not very many patients, and many of the studies were qualitative studies, meaning that they were based on interviews with families, very much like yourselves. Many of the studies were including families with LFS, and you might have been participating in some of those studies. Thank you from the bottom of my heart for participating in these research studies, because this is really where we learn as clinicians from you how to best help other families in similar situations. And so what we have learned from LFS families, from teenagers and young adults, that they really do want parents to discuss the risk about LFS and the cancer risk with them beginning at an early age. And similarly, parents want to tell, but parents can find it very challenging. As you know, LFS genetics is very complex information. So it's medically challenging to have these conversations, but it's also emotionally challenging. Parents are anxious about what, parents are a little bit anxious about what to say. They feel guilty about potentially passing on the gene mutation to their child. They are afraid about how their child's going to react. Are they going to be really upset? Are they going to be angry? Are they going to blame me? Are they going to run and hide in the room and not want to play with anybody? And they really want to preserve as much of a normal childhood as possible. And so, the teenagers and young adults want the information, advocate for a young age. The parents want to give the information, but they just don't know how or when to do so. And so along those lines, there have been studies that have focused on the actual disclosure experience. So there's a lot of fears that parents have about, if I disclose, if I have this conversation, is it going to hurt the child? Is it really going to be a negative and not really a positive? And so, like I said at the beginning, the overwhelming research data has really shown that there's more benefits than downsides to disclosure. So it really reduces having these conversations, reduce parental and child anxiety. So if you imagine you're worried about telling your kids, once you tell them, it's like a weight lifted off your shoulder, that it's no longer feeling like a secret, it's out in the open. And also can relieve some child anxiety. It really has been shown to empower the autonomy and health needs of children for taking over their own care, enhances coping within the family, emotional well-being, adaptation. So basically adjusting to the information and adjusting to the risks in the family. Having these open conversations can really be beneficial and can really bring families closer together. And sort of on the flip side, if you don't tell or don't have these conversations, that in and of itself can increase conflict within the family and anxiety. That kids may misunderstand where your anxiety or frustration or worry is coming from. So they can be confused. They can blame themselves, oh, mommy is anxious or mad, or, doesn't want to be around me because I'm bad or I did something bad. Or they could be afraid that you don't want to talk about the big sort of elephant in the room. Kids can really pick up on the emotions that are in the family and can really sense that maybe something is going on, and they may have a fear that it's worse than it actually is. So they may be afraid that they have cancer, or that something terrible is happening when really it's not as bad as what they're perceiving or worried it to be. They can also sort of, some of the adults and teenagers have expressed feeling anger and frustration towards their parents, and having really a weaker family closeness when the parents hide the information and don't tell them. So if they find out by overhearing their mom on the phone, or if, they're 20 or 25 and the family's known for 10, 15 years and they're just learning about it now, that can really increase the distrust within the family and also within the providers. So the, now we know that it's helpful to disclose. How is the best way to do that? So Werner, Lynn, and colleagues wrote this paper. This was a really nice model for parents about how to talk to kids about risk for hereditary breast and ovarian cancer. And so what we've done here is modified this model a little bit based on the literature we know about LFS and talking with kids, and our clinical experiences, and sort of modified it and to present it here for you all. So step one of this model. So when you're getting ready to have these conversations with the kids, and it's whether you're talking about a cancer diagnosis, a risk of a genetic condition, a positive result. Really, this model is good for any sort of difficult conversation that you're going to have, and can be really utilized with any age group. So the other important thing that I want to let you know before we do a deep dive is that as we go through each step, talking with your kids about LFS is really an ongoing process. So it's not necessarily one single conversation. So you don't have to get all ready to go, okay, today's the day I'm going to have this, sit down and have this conversation. And then it's all going to be out there, and then it's going to be over. So it's going to be a stepwise process that slowly emerges over time. And so the first part of the model, the first step, is really focusing on the parents or the caregivers themselves. So consider your own thoughts and feelings about the information that you're going to share. So whether you're sharing there's LFS in the family or a positive test result for you, how do you feel about having LFS? How do you feel about the cancers in the family? How do you feel about your child testing positive or undergoing testing? And it's really important that you get sort of a handle on your own emotions. It's not that you're hiding emotions from your kids, because we know that wouldn't be ideal either, but more that when you're having these conversations, if you're really distressed and afraid, the kids really pick up on that. And then particularly younger kids often mirror their reactions to those of their parent. So if the parent is presenting emotions and information in a way that makes it seem like it's really bad news or devastating news, that's the child can internalize it as negative information, and can really again mirror those reactions of the parent. So I think it's helpful for parents to understand how you're feeling about the information. And the paper also recommends making a plan if you can, because again, we're going to talk about timing isn't always perfect, and your plans don't always go as planned, but thinking about who is going to be there, when you're going to have the conversation, and where. So, and again, this is what works for your family, and it's not going to be, this isn't the one way to do it. These are just helpful tips and ideas on what you can incorporate into your own discussions with your family. But what research has demonstrated is, and recommends, is that if you're sharing information with your children, you share the same information with all the kids. So if one kid tests positive and one tests negative, you share the same information with both of those children, because that helps to avoid siblings feeling less than or better than their other siblings, resenting their siblings, really distrusting the parents. If, why are you having this special secret conversation with my brother? Why am I not having it? What's going on? So really having the conversation with all the kids is helpful. And having those conversations at times that are really developmentally, having those conversations beginning early and having them at a developmental age level that is appropriate. So we're going to go through some language that you can use along the way, but having those conversations early with a little bit of information and gradually giving information over time allows that information to be less shocking, easier to handle. Kids tend to cope better with it. Sometimes these conversations happen at critical life junctures. So if there's a cancer diagnosis, or if, let's say, a parent is undergoing a colonoscopy and they have the prep and they're in the bathroom for 2 days and the kids are worried about them, that something serious is going on, that could be a good time to sit and have this conversation and to talk about why you're getting a colonoscopy, and use it as a teaching moment. Kids, particularly older kids, have cancer genetics or learn about genetics in school. Sometimes they learn about cancer and health in school. So if they're having those lessons, maybe having the conversation at dinner about genetics and sort of bringing some of the family history in. It's also recommended that you let the child ask the questions. And so, or when the child is asking the questions, that's sort of a good time to be honest and answer them. And you don't necessarily have to have planned sit down meetings, but really working on empowering you and your family to be comfortable about having these open and honest conversations. And some families have found it really helpful to have a family meeting where they discuss important topics, and it's a routine that is comfortable for their family. What we don't recommend necessarily is to have your first family meeting be about LFS or about genetic testing, because family meetings can sometimes be scary if you've never had them. And so you don't want to associate LFS or cancer risk with necessarily being bad. I know I've heard from many parents, and I've actually found it true for my kids, is that I can actually get them to talk more when we're in their car. They're in the back seat, we're talking, I'm trying to learn about their day. For some reason, that's a lot easier to get them to talk than sitting at the dinner table. Or so find the time that is comfortable for you, works with your kids. to have these conversations. And you're going to hear this over and over again, but you really know your kids best. And so these are helpful tips and tricks, but definitely not necessarily the one or only way to do that. So when we talk about what we're telling the kids and in what way we're telling them, it seems to be much better way to answer what the child is asking. So if they ask a question about why there's so much family, or it seems like there's a lot of cancer in the family, why is that? Being honest and answering that question can be really powerful. And answering honestly without holding information and without giving too much information is really helpful. Because you imagine, I'm sure you've all been to the doctor and the genetic counselor, and they just sit there and they spiel all this information about genetics, about LFS from like here to here, and it goes in one ear and out the other, and maybe you get a little bit of information out of that. So we don't want to do that to our kids, and it's really not going to be helpful. So giving a little bit of information, and really the information that they're asking for tends to be really helpful. What was the other thing I was going to say? I forgot there, but that's all right. So, I mean, everybody, what I wanted to say was, that's it. If you're asked a question by your child and you are not emotionally ready to answer that, or you don't feel like you have the knowledge to answer that, it is okay and very appropriate for you to say, thank you for this question, I will answer it. Now is not a good time. Or I don't know the answer to that question, I'm going to find it out and let's talk about it later. So that you're telling them that it is okay to ask these questions. You're going to be open with them about answering them. And so that they can feel comfortable asking those questions again in the future. Because what you don't want to happen is, nope, let's not talk about it. And then they're afraid to ever bring it up again. And that's what we want to avoid as well. In step 4, we're going to allow the child to get some space for their own reactions. So you can check in with them. You might anticipate how they're going to respond if you have an anxious child, or a child who's very emotional or not. They might just want to get back to their video games. But checking in with them, ask how they're feeling. A couple days later, maybe check in with them, see what their thoughts are. And again, this is an ongoing dialogue. And so it's not a one conversation and done. It's open and honest conversations over time, and you're going to process this information differently over time. You can just think back to when you first learned about LFS or learned about the cancer in the family, and think about how far you've come since then, and help your child. The goal is to really help your child process that in a healthy, good way, where this is not scary information, and emphasizing that it doesn't change who they are. It doesn't change their goals. It doesn't change their dreams. It doesn't change what they can accomplish. It's just going to be a part of them. And I will pass it off to Carly.
Thank you, Jackie. So this next part is really a little bit of just kind of a review, jumping off of a lot of the great tips that Jackie already gave you. And these tips are tips we put together that have to do with, again, the literature, and also just, I think, our own experience with our families with LFS, and even just being a parent. So some of this is of just instincts too. But one thing in terms of talking to kids about Li-Fraumeni syndrome is drawing from previous experiences. So like thinking back to other conversations you've had with kids that might be about something difficult or stressful, and think back to that what worked well and what didn't work well, and sort of learning from that in terms of how you approach this, the issues of hereditary cancer with them. Again, like Jackie was discussing, just allowing your children's questions and reactions to guide you, and not sort of feeling this pressure of like, now it's time to have this talk and I'm going to just unload everything about this topic all at the same time and just check it off the list. As we're going to get into in a few minutes, kids of different ages and developmental stages have different ways of thinking about things. But I think ultimately, this is a lesson I've learned as a parent and as a genetic counselor. Sometimes what your kids are asking you is much simpler than what you may be worried about in your head, right? I know that with my own patients, adults included, I used to get really stressed out if someone would say, well, how does the genetic testing work? And I would suddenly think, well, I better know how to explain the real details of the technology of genetic testing and the science behind it real quick, when really they just wanted to know, am I getting a needle stick or am I spitting in a tube or something? So I think just to pay attention to what your kids, especially when it comes to talking about the birds and the bees, I can tell you that, like, same deal, just need to know basis. So normalizing. So I think, when it comes to kind of explaining like what to expect or what's going to happen next, it helps most kids if they can relate it to somebody that they're already familiar with, like a family member. So for example, from time to time, you'll get some additional tests or screenings, that's what I mean by tests, like screenings that don't hurt, similar to what dad does or your sister or brother does or mom or so on. It's always a good idea to frame information in a positive way, which I know that might sound Pollyanna-ish when this can be a really stressful topic, but I think there are ways of saying things that can be more positive. So rather than focusing on like illness and death, just we're doing things to keep you healthy, right? We're the point of this is that we're going to the doctor to make sure that everyone can stay healthy. So just thinking of positive spins on some of this, I think can be really important. Taking your time as well. And I think the taking your time piece kind of overlaps a little bit with, well, a lot of these things overlap, but just with what Jackie was saying about just like assessing where you're at yourself, emotionally and cognitively with this information. Because, if you're still really, really upset or you're not fully understanding the situation or, whatever piece of it, it's important to allow yourself some time to process that first, to get some answers, have some time to kind of come to terms with some of it, so that you're at a point where you can be a little bit more calm and talk to your kids about some of these concepts. And again, it's going to be an evolution. It's not a one-shot thing. It's something where you maybe do a little now and a little later and a little next year and the year after. I think having a team approach with medical providers as you're having these conversations is really important and helpful. I mean, there may be certain words that you prefer to use or certain words that you prefer to avoid. And that's okay. I think you can certainly feel free to talk to, your medical team, genetic counselors, and kind of so everyone can kind of be on the same page about that. And that may change over time, but I think we're always here to work with you as a team in doing these things. The Werner-Lin paper is basically looking at sort of all this information and research on child development and psychology, and sort of synthesizing that and framing it for sort of how we use that information to sort of approach different age brackets of kids as we talk to them about hereditary cancer risk. So it sort of breaks it down into a few different age brackets, starting with the preschool age, so like 2 to 4 years old, which of course is very, very young. Kids at that age, as you know, are, their whole worlds are basically their parents or caregivers and maybe school or daycare and just the people that are right around them. They tend to have magical thinking. They explore the world and learn a lot through play and fantasy. They tend to they kind of need very, very concrete information. They don't really have much of an ability for abstract thinking at that age. So if questions come up from them about something, again, listen to what they're really asking you. It's probably pretty basic. But I think, so you probably don't need to give them a ton of information at this stage, of course. And this is where using books and pictures can be really, really helpful. And in a few minutes, Jackie is actually going to give you some more, talk in a little bit more detail about some great book resources that have great pictures. And in fact, at the end of this particular Werner-Lin study, there's a whole list of books that can be used. And these are books that have to do with just genetics concepts in general. So they're not specific to Li-Fraumeni, but if you were going to send out our slides after this talk, and you can certainly look for that paper and have a really nice list of resources that might be helpful. Probably more so for the older set, but there's a lot of different options here. So again, yeah, simple concepts, just, ideas of traits being passed down, how we look like our parents, and I can curl my tongue, can you curl my tongue, things like that. Okay, so now we're into sort of the next age bracket, which is sort of the school age, younger school age set, so like 5 to 10. And this age range, that kids are able to think more logically, but they can sometimes be a little rigid. They can start to think a little bit more abstractly and hypothetically than the younger set. And they learn through visual cues. So again, using things like, I can curl my tongue, can you curl your tongue? They're ready probably at this age in most cases to start to learn a little bit more, more detail, a little bit more in-depth ideas about genetics concepts. So, talking about what genes are, how they can be the instructions that tell our bodies how to grow, what to keep us healthy, how they can determine hair and eye color, how they're made of, DNA is made of letters. And again, the ideas of inheritance and traits and what things we maybe have in common with like our parents or our siblings. Talking to them about the purpose of testing, again, keeping it positive, of course, so to keep you healthy. And just being able to explain to them possibly a little more detail about what cancer is. If those types of topics come up, they're going to be able to handle this information a little bit better, obviously, than the younger set. But 5 to 10 is quite a range too. So obviously it's going to depend so much on where they are in that age range, and every kid is a little bit different, obviously. So
now we're getting to the kids who are a little bit older, middle school age. They start to have more concrete thinking and able to think more abstractly about the future. They can reason through different situations and scenarios. And this is the age where we start to assent for genetic testing, which basically that means we have a conversation with the child about the test that they're going to have and get their permission or approval to do the testing. We're going to have a whole pro and con discussion in a couple minutes about whether or not that is an absolute necessity, but we try to give the minimum amount of information to the child in order for them for us to feel comfortable that they're answering, they know what they're getting they're tested for. So information and more they can understand more complex genetic concepts. You can build on previous concepts. So for the younger kids, you talk about genes, being made up of dozens of DNA letters. Genetic testing is kind of like a spell check machine. So now that they can read, they can write, they can spell, we're doing a spell check to see, are there any misspellings in the gene that prevent that gene from working, prevent that gene from making sense to the body. They can also understand a little bit more about inheritance. So with Li-Fraumeni syndrome, there's autosomal dominant inheritance. So if you have the gene mutation, there's a 50% chance to pass it on to each child. And so the child that you're talking with could have a 50% chance to have the same mutation as mom or dad. And it's like flipping a coin, heads or tails. And so you can't, you don't know what you're going to get, and parents can't pass on the gene or can't control what they pass on to their kids. But they can better understand that concept of 50-50. And then they can start to understand a little bit more about with that abstract thinking, the idea that of penetrance, which basically is if you have the gene mutation, what is the chance of getting cancer? And most of the time it's not 100%. So just because you have Li-Fraumeni syndrome or have the gene mutation does not mean you are going to develop cancer. And actually, at this age of 11 to 13, the actual chances of having a cancer or developing a cancer are very low. And so they can start to understand that a little bit more. What we like to give as examples is, if they exist in the family, say, oh, aunt or uncle Sue or grandma and grandpa have the gene mutation and they've never developed cancer. And so that can be really powerful for kids as well, to see other family members in that situation. As the kids get older into the high school age and beyond, they are much better at the abstract thinking and deductive reasoning. They're probably learning a little bit about genetics in school. But this is also a really hard time for them because they're starting to form their identities. They're going through puberty. They're trying to get independence from their parents. And so having a genetic diagnosis in the family and having that happen at a time when they're trying to gain independence can sometimes be really hard for the families and for the kids. And so just keeping that in mind. And then also, as you know, with LFS, there's a high risk for breast cancer. When I've heard when children or girls start developing breasts, sometimes they could potentially be afraid that they're going to end up getting the breast cancer and dying, just like so-and-so in the family, because there is that connection in the family. So also thinking about those things and maybe correcting some misinformation, but just knowing that this is emotional time for the kids. But they also have the ability to understand the cancer risks and management and can really express their thoughts about testing and thoughts about their experiences in their family. And I've met with many teenagers who've had cancer to do genetic testing for them, and they can be very eloquent on their thoughts about the pros and cons of testing. So I've had teenagers express that they really want genetic testing because they want to identify if there is a cancer risk so that they don't have to be surprised if they get another cancer down the road. On the other hand, I've had teenagers say, right now I'm in the middle of cancer treatment. I am so emotionally overwhelmed and drained, and my parents are so stressed out. I really don't think now is a good time for testing. And so that we do try to give them as much autonomy and input in their decision making as we can. And here are a couple examples of some books that Carly alluded to earlier that can really help have these conversations with the kids over time. So I think a lot of you are familiar with Robot Music. It's been published a couple of years ago. It's a really nice story geared towards young kids and learning about the, there's a child's experience going to have an MRI and so can see what it's like having a risk and going through screening. And then a newer publication is LFS and Living My Best. And this is a booklet that was published and written by the multiple genetic counselors and supported by the National Society of Genetic Counselors, as well as the Li-Fraumeni Syndrome Association. And a link to all of these books are on the Living LFS org resources on the webpage. And then also Andy placed a link in the chat. So if you want to link to that and scroll down to the book section, you can find them. This is the LFS and Living My Best is a really well done booklet that talks about Li-Fraumeni syndrome. It talks about cancer in general. It talks about surveillance. It defines different words, talks about genetics. So it can be really, I think, really helpful for really any age, but it's geared towards teenagers. And then Emily Goes to the Doctor. That's a book that was written by a genetic counselor in Australia, and Georgina Schleb, and she wrote this book as part of a research study that was really nice, looking at bibliotherapy, which is basically using a very focused, well-written book to educate children about genetics. And so Emily Goes to the Doctor is about a girl who has LFS and the family who has LFS. And she is currently editing the book based on feedback from her research participants, and will be making this publicly available in the beginning of 2022. So be on the lookout for that as well. Carly.
Yep. So I guess as genetic counselors, we have had this kind of a question several times in different forms. We used to do most of our genetic testing on blood samples. Now with COVID, we've been doing a lot of them on saliva samples, but it used to be like, can't we just test them? Can't we just draw their blood and, my child's blood, or get a saliva sample and not even talk about, what it's for, kind of thing. And so this is just sort of, I guess, breaking down in the two categories of the way that we might think about this as genetic counselors. In favor of sort of not involving the child in sort of this sort of pre-test consent process. There's always this idea of, not wanting to worry the child, although on the flip side, if you look in the middle of the nay group, that might be a child that would worry anyway, or might even worry more if we're keeping secrets from them, as Jackie was kind of talking about earlier. Respecting parental autonomy is important, though. So, there are situations where, the parents may just know the best thing. It's, they know their child the best. So there are times where this might be an okay situation. Sometimes testing benefit outweighs the risk of not discussing it with the child in advance. There are situations like that. There are specific circumstances. There might be developmental issues or other things going on. It might certainly be age dependent. If it's like a really young kid, obviously like a baby, you're not going to involve them in the pre-test counseling. But we have a longer list under nay, meaning no, let's yes, try to involve the child in this process. Kids of a certain age, ethically, we are kind of obligated to at least try to get what's called assent, which, the parent or the adult person who is caring for that child ultimately will sign consent. But assent is really inviting the minor in to be part of the conversation at whatever developmental level they're at. And generally, you try to start this, or maybe around age 7, if you can, is getting them at least somewhat involved. Like, again, like Jackie said, if we're not involving the child at all and we're keeping all these secrets, you do risk losing some of that trust in relationships with, adults and loved ones who have relationships with that child. It can really be, I think, empowering for a child to feel like you're involving them, you respect them, and you're being transparent and open and really engaging them in this process. As genetic counselors, there's always a concern that if we don't involve the child at some point in the pre-test counseling piece, that the parent might not ever share the results with the child. So that's always just something to keep in the back of our minds. We talked about the next one. Sometimes even as parents, we underestimate what our kids can handle and how mature. I think in some cases, we do know our kids better than anyone else, but I also think that we don't always have perspective, especially when it comes to these stressful, difficult kind of high stakes situations. Engaging kids and getting the whole family involved doesn't improve compliance with the medical plan. So maybe they're more likely to not give pushback on doing the screenings and going to the doctors and stuff if they're engaged from the very beginning. So again, like alleviating anxiety and sort of distress with just like really engaging kids as much as you can in this process from the beginning, I think can really be helpful. So overall, there are times when we don't involve the kid, certainly, but we like to whenever we can. We think it's a good idea. So next slide, please. So we have talked a lot now and we want to hear from you, but just as a real quick takeaway, there really are ways to talk to kids about Li-Fraumeni syndrome, about genetics, and about cancer risk. Kids really of almost all ages. And there's no right or wrong way to do it. There's no one way. You know your child best. These are just tips. Providing information and emotional support to whatever place your children are at developmentally and cognitively and so on, is important. And to keep the conversations with your children open, honest, and ongoing. And it's okay for those to evolve with, your own journey with Li-Fraumeni syndrome and sort of sharing some of that with them. I think that can be really beneficial. So that's pretty much it. Just wanted to close our sort of talking, Jackie and me doing all the talking portion of this by sharing this quote that was from one of these papers where some of you might have been involved in this, where 14 parents of children who tested positive for Li-Fraumeni syndrome were interviewed about all their ideas about talking to kids. And this is a really, I think, empowering quote. So we've taken the power in our own hands. We're going all the time to get you tested, which I think means like screened or going to the doctor, to make sure that as soon as the day comes, we'll know and we'll know what we need to do. So it's just this, I love that quote because it's just this idea of being empowered and empowering your children to be ready and to be ready to take control of their own health. So I think we have a list of resources, or rather references on the next slide, which we can sort of fly right through. Jackie, I don't know.
Yes,
Yeah,
and we'll provide a PDF of the talk on the Living LFS website and then the webinar, so you can look a little bit more closely. And then if you want any of these references but don't have access to them, just email me and I can send them to you. And so I know Carly and I took a lot longer than we promised. I'm sorry on that, but Carly will have to go at 2, but I can stick around and Andy will stick around. And you guys are welcome to stay. We would love to hear from you what your experiences have been having these conversations with family members, what advice that you give to others, and any questions that you might have for us. Carly and I were also thinking about doing some sort of presentation to children, and we're wondering what your thoughts would be on that as
So
well.
Amy has asked, is the risk of pediatric cancer still considered to be 40%?
I thought it was closer to 20%. Did I get that wrong?
I know I'm trying to, I need to look at the
That makes me feel better that Jackie too needs
the
to check.
references. I'm like, I should have this on the tip of my head. I feel like the numbers are constantly evolving.
Yeah.
And so I want to say something about 50% by age 30. And
I'm looking at something that does say 20% before the age of 20. So I think
20.
it is closer to 20% in childhood.
Yeah. I think in childhood technically is around 20%, and then maybe 50% by age 30.
That's what it's 50% by age 30.
Yeah. 50% by age 30. So somewhere in there. But what we're learning over time is that, so these are also cumulative risks. And so when you think about, it's when you hear that 90% or 100% female, that's over the lifetime. And so at any one given moment or any one given year, the risk, depending upon the age, so like a teenager or a 10 or 11-year-old, their absolute risk of developing a cancer at that moment in time is very small. And what we all are also learning is that a lot of this data is based on older studies. So the studies where there's very classic Li-Fraumeni syndrome, where there's a pathogenic variant in the TP53 gene that leads to a very high risk of cancer in multiple individuals in the family. But we're learning over time that there are a lot of other factors involved, and not every family is the same. And so the overall risks for cancer, if you think for the whole LFS population, is going to be much smaller than those numbers.
All right, Erin says, I think a presentation to children would be amazing. Thank you for that, Erin. And I also put in the chat Jackie's email address. So the slide that she mentioned earlier that has the resources on it, if you want to get access to any of those resources, you can email Jackie at livinglfs.org. Mary says, regarding the link you provided above, can you help further with navigation to find the robot music book? If you go to the resources page on our website, scroll almost all the way down to the bottom. There's a section on books. It includes the robot music book as well as the Living LFS and Living My Best booklet for children.
The robot music book is a book to purchase on, and the link is to Amazon. And then the LFS and Living My Best is a free booklet.
And you can download that right from livinglfs.org. Jennifer says, no question, but this is great. We recently started talking to our 2-year-old as his cancer treatment was wrapping up and port removed. Helpful to see how to approach based on child development.
Awesome. Thank you. Glad we could help.
Deanna says, do any of these resources discuss additional testing when something is seen in a way that the kids may not be frightened?
I don't remember offhand when you say, oh, resources, I don't know if you're referring to the children's books or the references. But offhand, and Jackie, correct me if I'm wrong, I don't remember seeing anything specific to that.
Yeah, I don't remember. I wonder what I don't remember specifically on that. I know that, when we start doing the surveillance in kids and we talk about doing MRIs or ultrasounds, we talk about everybody having differences. Like, we all look different on the outside, and our bodies also look different on the inside. And when we start taking pictures of the inside, we find differences. And so sometimes we find something that just needs to be looked at a little bit more closely. I don't know if that is helpful.
Well, and I also think, and I don't mean to, I know, I'm not in that situation myself, and so I can't speak to that, but I think a lot of the concepts that we've been talking about trying to put sort of a positive spin on it can probably be applied in terms of like, we just need to double check and make sure that if there is something happening that, we can find it and keep you healthy and fix it. And, I think some of those, I'm sort of just riffing here, but probably similar concepts to apply. And it may be that you're really frightened. I would think I'm sort of projecting here as a parent, like that seems terrifying. And maybe, maybe giving yourself time to like, just think through it and process and do whatever you need to do first before you sit down with your child and sort of talk about what's happening next, instead of just like blurting it out, which I've done that too, like in an emotional moment. We've all made those mistakes, but again, I'm just riffing here. I'm not, nobody knows all the answers to this stuff, but I think you could probably apply some similar ideas.
Lisa says, I agree. I think a webinar for kids and young adults would be great. I recently was diagnosed and shared that diagnosis with my 19 and 22-year-olds. They were both tested and one was positive. We provided the results to both of them at the same time. It seemed to be a good way to deliver the results.
Yeah, that's great. That's great. Thank you for sharing that.
Mary says, is there a possibility of another webinar coming on a nutritional holistic approach for preventing and beating cancers? We haven't discussed that, Mary, but we will take that under advisement. Maybe that is something that we can organize. And something else that I want to mention is that in August of 2022, we will be doing the Jennifer Mallory Living LFS Family Camp, our second one. That'll be happening in Colorado, and I will put the information for that into the chat as well so that you can get more details on that. And I will also include the link so that you can sign up for the Living LFS mailing list, so that as we come up with new events, new webinars, and new activities, that you can be in the loop on all of those as well. So look for those in the chat momentarily.
And I'll just follow up and say that nutrition was one of the breakout groups that we had at Family Camp last time, and it was very well received. And hopefully we'll be doing some live streaming this time as well.
Lisa says, thank you both for the info. I was so desperate for this information years ago. I'm thrilled to have such access to this info. Thanks so much.
Thank you, Lisa.
Thank you, Lisa. Erin says, anyone with experience with, whoa, it just moved. Anyone with experiences with sharing with young unaffected kids, meaning no cancer, and older unaffected kids.
I think that was geared towards the other participants in the
Mm-hmm.
chat.
And I will say that was a big part of Family Camp, was bringing everybody in the family together, affected and unaffected, and getting to meet families that were experiencing those similar conversations, and kids getting to meet each other who weren't affected but had siblings that was pretty powerful, I thought.
I just got a private message, I believe is intended for the entire group. This is from Karen. She said, very interesting and reassuring, as I've always been open and honest with my kids who were 10 when I went through treatment and we were all tested. One problem we're having is that only one has the mutations and sometimes feels it's unfair. So any advice on sibling dynamics?
That's a great question that is really understudied greatly. And I will put in a shameless plug at this point for a research study that we are doing as part of our clinic. We're interviewing families that have children who one child tests positive and one child tests negative, and the parents. And so we're hopefully going to be getting the learning more about the impact of an LFS diagnosis on the unaffected kid, as well as the child who has the mutation but doesn't, but has the sibling without. I know that often the unaffected kids, whether it's unaffected and they don't have cancer, or unaffected, meaning they don't have the gene mutation, feel left out, or feel that there's special treatment. I know some families, depending on how old they are, they'll make a special day about screening, and they'll, the affected child goes in and will get, a toy or something, but then the unaffected kid who's not going also gets a special day with the parents that are separate from that, and so that they're not feeling left out, that they get their own one-on-one time.
Lisa, welcome. Thank you for turning on your camera and mic.
Yeah. So my family, we were recently diagnosed. In our immediate family, we don't have any cancers. However, I'm positive for LFS, and my daughter, who's 19, is also positive. My 22-year-old was negative. And I'll just share that when I got tested, they had the full body of genetic testing done on me, and I was just positive for TP53. And when we talked to my kids about that diagnosis and getting tested, my son, who's 22, only wanted to be tested for the specific TP53. My daughter wanted the full body of testing. So that was different, and they both expressed what they desired. My son was negative for TP53, and my daughter was positive for TP53, but no other genetic mutations. When we gave them the results, my son offered some concerns that he had, related to my daughter, about whether or not she was going to pass this on to his nieces and nephews. But he did it in a great way, just kind of expressing his anxiousness about his future family members. But he also talked about the fact that we believe this came from my father, and my brother is negative. And so then I had two kids, one was negative, one was positive. So he was able to provide, a lot of encouragement to my daughter that her future children, some of them could all be negative. And if they go with the same diagnosis as the last three generations, it's possible that half of them would be negative and half of them would be positive. So my 22-year-old, when we did it together, I just wanted to express our experiences because he was able to give a lot of mature, responses to her that I think helped her, because he was there with us when we shared.
Mm-hmm.
So
That's
I'm just
fantastic.
offering that in case it might help somebody else who has to talk to their young adults.
Mm-hmm.
And that was actually a great response to Karen's question, which is that they only have one in the family with the mutation, and that person sometimes feels it's unfair. So any advice on sibling dynamics? So Lisa, thank you very much for contributing that. That is very helpful. That's great. And as I mentioned, I did put Jackie's email address into the chat. So if you do have questions that you would prefer to ask privately, or if you do want access to any of those resources that she mentioned earlier, you can email her directly for those.
I'm really sorry, but I have to actually go now.
Carly, thank you so much.
But thank you so much for the
Carly.
opportunity. And I am looking forward to hopefully seeing some of you at camp this summer.
Fantastic. Thank you, Carly.
Thanks, everyone.
And I'll just remind folks that we do have a Facebook support group that is over 1,500 people now, I think. So it's a great place where people kind of share these stories and connect with each other and connect with folks who are local to the area. So if you're not part of the Facebook group, you can look us up under getting support on the Living LFS website.
I will also post the link directly to the Facebook support group. And this is a private group that is specifically only for people that actually have LFS. So you can feel comfortable that you will be talking to others who understand where you are. And so that is in the chat now. Jackie, thank you very much for this presentation and for your insight and for making yourself available and for all of these resources. This has been fantastic.
You're very welcome. Thank you.
And thanks to everybody for joining. And
yeah, absolutely.
Yeah, this is great. Thanks, Andy,
Thank you
for
for
hosting.
sharing your stories, everyone.
Yep, absolutely. Thank you all so much. And yes, join the mailing list so that we can keep you up to date on future events that we have here through Living LFS, and visit the website at livinglfs.org for more information. And we will send out this recording once it is available for everybody to rewatch and to share with your friends and family and others who might benefit from it. Thank you all for joining us today.
Great.
Everybody.
Thanks. Have a great day.